Hey, it's Dr. DeCubellis. Today I wanted to talk a little bit about what it means and how we're treating children with neurodevelopmental disorders, anxiety disorders, these types of things. The biggest thing that I want to make 100% clear is that every child is going to be different. No two children are the same. So what that means is that even if they have the same diagnoses, the way that they act, respond is going to be different because they have different environments, they have different parents, they have different school teachers, they have different siblings, they different houses, they eat different foods. So there's going to be differing ways that they actually express the different things that they have going on. Now that's very important to keep track of because what that means is that the way they improve through treatment is going to be different too. So what I always like to do is ask parents to keep journals to make sure we can keep track of different things because you're not going to remember exactly what was going on 3 weeks prior and compare it to today with the exact detail that we need to see what changes are being made. It's very important because, again, even if we're treating in our office, most of the time they're not in our office. Most of the time they're at home, right? So if there's little things we can change or tweak or affect at home, that's going to be super helpful because again, they're spending more time at home than they are in the office. Plus the home is the place where they're most comfortable, where they probably develop more of the habits and more of the responses to certain stimuli. So I want to know what is changing, what isn't changing, and this way we can kind of track and we can make changes and improvements as needed based on how they're improving too. And the other reason that's important is things don't always change at the same rate. Different issues are going to change at different speeds based on different factors too. Different factors being who they're around. So for instance, if we're treating a child, they're showing improvement, and then over the weekend, all of a sudden they take a couple steps back, and we come in and we're talking about next weekend, it's important to note that maybe the reason they had a differing response or what would be considered a setback over the weekend is because they were around their cousins, which they haven't seen in 2 months. Now that's a big difference. That's a new stimuli that we haven't been able to work on or get any data on yet. So that's okay. It doesn't mean there's necessarily been a setback. It means there's been a new stimuli, and that stimuli needs to be considered. And again, we need to check on that. So the same thing too is if the kids are out of school and then they go back to school, the behavior is going to be different because they're in a different environment. So it's important to keep track of all these different things because again, we're not just trying to help improve the function, the nervous system function, but we're also trying to change habits. We're trying to change the muscle memory. We're trying to change all these different movement patterns so we get everything working as best as it can. But we need to know different ways we need to tweak things too so we get the best possible results.